So, Bismillahirrahmanirrahim. So today our topic is dengue fever and dengue hemorrhagic fever. You most are aware of this disease over there that mostly it is found in from August to September in Karachi and in Pakistan when there's a mild cold weather. So we go for this. What is a dengue? Mostly it is known as a dengue fever is a virus infection caused by the dengue virus. There are four kinds of dengue viruses. Now it is Aedes aegypti mosquito which cause the dengue fever. Aedes aegypti mosquito, remember, in case of malaria there was Anopheles. Here there is Aedes aegypti mosquito which carry the virus. We again see this, it is a different shape as compared to Anopheles mosquito. So mostly it is found in fresh water, in roads, wherever the fresh water is there. So there was a question that dengue is not found in Liari, it is mostly found in defense. Why? Because it lives grow in a fresh water, not in dirty places. So mostly it is found in you can see these are area where dengue can grow over there. When this is the patient, when admitted in a hospital, mostly these have say placed in a hospital. You see how they are kept in hospitals. Mosquito nets are placed over there, and the patient is inside the hospital. Further, you can see how they are taken care in a hospital with nurses. Nursing care has been done to the patients. Further, you can see that so dengue disease. What is the dengue disease? So dengue, the disease is an infection of tropical and subtropical regions. Non-specific febrile illness leads to fatal hemorrhage disease. Infection caused by virus and spread by an insect vector, the mosquito. I told you as earlier, Aedes aegypti mosquito. It is caused by Aedes aegypti mosquito. Sorry. So it is mostly the virus is carried by Aedes aegypti mosquito. So dengue viruses, it is from the family, it is a flaviviruses RNA. It is a flaviviruses RNA. So flavirus is a genus of positive strand of RNA viruses in the family Flaviviridae. Its genus includes the West Nile virus, sorry, West Nile viruses. So dengue viruses, tick-borne encephalitis viruses, yellow fever viruses, Zika. So this family has this type of also further viruses. They can have dengue viruses, tick-borne encephalitis viruses, yellow fever virus, Zika viruses. So this family has different types of viruses. Further known as it is a arbovirus group is an informal name for any virus that is transmitted by arthropod vector. The virus is carried by arthropods, also known as arbovirus group. It has four serotypes, then 1 to 4A. Now, what is serotype? Serotype or serovar is a distinct variation within a species of bacteria, viruses, or among immune cells of different individuals. These microorganisms, viruses, or cells are classified together based on their cell surfaces, antigens, allowing the epidemiologic classification organism to the subspecies. So it has 4 serotypes of dengue viruses. Its cycle involves humans and mosquitoes. Infection with one virus gives immunity to that. So it happens to once a patient, so it can introduce immunity from that serotype only. So what's a dengue vector? Further note that Aedes aegyptis, a albopictis less. So it has 2 types. One is albopictis. It is mostly you have learned about Guinea virus. Sometime after that dengue, there is also a Guinea virus. So Guinea virus also it is from albopictis virus. So domestic, the mostly day biting mosquito. In case of that malaria, it is a night biting, but it can be domestic day biting mosquito. Prefers to feed on humans, breeds in stored waters, short flight range, may bite several people in same household. So it is a characters of a dengue vector. How it replicates? Replication and transmission of dengue virus. Part 1, how it does? One is that virus transmitted to human in mosquito saliva. Virus replicates in target organs. Third, virus infects white blood cells and lymphatic tissues. In 4, you can say then the virus released and circulate in the blood. So 4 steps in which it has to be replicate. Further, they go for second, mosquito ingest virus with blood. Now 6, virus replicates in mosquito mid gut and other organs, infects salivary glands, and then virus replicates in salivary glands. History of, if we go for the history of this dengue fever or dengue is there, or dengue, whatever you can say that. The first reporters epidemics in 1779-80 in Asia, Africa, and North America. You don't know, it's not an early disease. It's from older days, this disease has to be spread. We think in 2005 that it is a new disease. No, it is not a new disease. It is from history, a disease is. So considered mild, non-fatal disease. Earlier it was thought that it will maybe. Epidemics every 10 to 40 years due to introduction of new serotypes. After World War II, pandemic of dengue, which began in Southeast Asia, expanded geographical distributions, epidemics with multiple serotype and emergence of dengue hemorrhagic fever. Re-emerging in 1980, a second re-expansion of dengue hemorrhagic fever in Asia with epidemics in India, Sri Lanka, Maldives, Taiwan, people with China, Africa, America, Pakistan. Progressively larger epidemics. You have made reported in 2013 and in Punjab, it happens in, I think in 2015 it happened, 18 it happens in NW and Khyber Pakhtunkhwa over there. It's a mostly primarily urban disease. So what's the reason for resurgence? Uncontrolled urbanization and population growth, substandard housing, inadequate water, sewer and waste management, deterioration of public health infrastructures, faster travel, ineffective mosquito control in endemic regions, hyperendemicity, prevalence of multiple serotypes of these are reasons for the resurgence of happens of dengue fever is there. So what are the clinical features, symptoms of that? Incubation period is 2 to 7 days. Sudden fever rises from 40 to 41 degrees Celsius. Non-specific constitutional symptoms, severe muscle aches, retroorbital pain, hepatomegaly, rash, facial flush, fever subsides in 2 to 7 days, maybe biphasic. There are chances of that can be. So case definition by WHO for dengue fever is that the acute febrile illness with two or less than more than of the following: the chance of headache, retroorbital pain, myalgia, muscles, arthralgia, rash, hemorrhagic manifestations, leukopenia, hepatomegaly common in dengue fever is reported. Then clinical course of dengue is that what have to do when there is a dengue virus infection. It has two types: asymptomatic and second is symptomatic. In symptomatic, further they have classified into undifferential fever, dengue fever syndrome, and third is dengue hemorrhagic fever. A plasma leakage happened over there. Now, dengue fever syndrome without hemorrhage, unusual hemorrhage happens. And dengue hemorrhage D.H.F., there is no shock, then that leads to dengue shock syndromes. So, how to diagnose by WHO says that diagnosis often occurs with differences of fever. Up and down of the fever is there, swelling. All of the following must be present: fever, hemorrhagic tendencies, positive tourniquet test, patchy ecchymosis or purpura, bleeding from other sides, thrombocytopenia, evidence of plasma leak, rise in hematocrit, drop in hematocrites, pleural effusion or ascites, and hypoproteinemia can be found. So you can see the different rashes over the skin of this pic over there. Shock, damage, shock is there. All of the above past evidence of circulatory failure, rapid weak pulse, narrow pulse pressure, cold coming skin, restlessness, often present with abdominal pain, mistaken for acute abdominal emergency over there. Further grading of dengue virus infection is there. First is the simple dengue fever. Symptoms: fever with two or of less than of headaches, retroorbital pain, myalgia, arthralgia. There can be symptoms, two or more symptoms of these type. Lab tests found leukopenia is there occasionally. Thrombocytopenia, no. Evidence of plasma is no evidence of lab, and if there is only dengue fever. Hemorrhage fever 1, grade 1 is this, all above plus. There can be tourniquet test. There can be platelets less than 1 lakh. HCT rise up to 20%. Grade 2 above plus spontaneous bleeding happens over there. Similarly, there are platelets and hemocrites rise happens over there, decrease over there. Grade 2 is there, spontaneous bleeding over there, and shock is there above plus circulatory failure over there. Then profound shock and undetectable blood pressure and pulse found in grade 4. That confirms the evidence of dengue virus infection over there. Now, how to manage them? This is the main part which you have to learn. How to management and prevention of the uh, dengue virus or dengue fever is there. So treatment is supportive. There's no special treatment for the dengue virus or dengue fever. Em- Emphasizing fluid replacement and appropriate management of shock and organ dysfunctions over there. With intensive care support, mortality rates are 1% or less if can be taken in control. Aspirin should be avoided due to bleeding risk. Aspirin cannot be given, or that NSAID cannot be given in dengue virus and dengue hemorrhagic fever. Corticosteroids have not been shown to help over there. No existing antiviral are effective. Breeding places of Aedes mosquitoes should be abolished and adults destroyed by insecticides. There is no licensed vaccine available for the dengue virus. So no special treatment is available for men with dengue fever. Analgesic and antibiotic can be given. Avoid agents which may impair platelet function aggregations, aspirin. So NSAID cannot be given in dengue fever because they enhance the platelet function over there. So that's the only paracetamol can be given to as an antipyretic in such cases. Then if there is dengue hemorrhagic fever, bleeding happens over there, what do you have to do? Hospitalize the patient. Closely monitor for shock, repeated hematocrit measurements, acidity rising by less than 20, IV fluids as 5% deficit, start with dextrose and armoxicillin 6 to 7 milliliter per kg per hour. If it then improves, reduce gradually over 24 to 48 hours. No improvement, increase up to 15 ml per kilogram per hour. Then they go for also colloid solution. So in hemorrhagic fever, if I see less than 20% above normal, then start IV fluids, ringer lactate or dextronormoxicillin 6 to 7 ml per kg per hour. Monitor HCT, HR, pressure, and then if improves, HCT decrease, blood pressure rises, reduce. If it improves, then they have 3 ml per kg per hour. Further improvements, then discontinue IV fluids after 24 to 48 hours. In second case, hemoglobin rises, pulse pressure falls, then to 10 ml of kilogram per hour. If no improvement, 15 milliliter per kg per hour can be given. If unstable vitals, CVP line, urinary catheters, rapid fluids, bolus, if HCT rises, collides, and if HCT falls, check the bleeding time of the patients. Classification was over there, how to do that one. Probable dengue is there, warning sign is there, severe dengue is there, what to do. And dengue live in or travel to endemic area, fever increase 2%, two of that one, nausea, vomiting, rash, H's, X, pains, test positive. Then they go abdominal pain or tenderness, persistent vomiting, clean food accumulation over there, lethargy is there, liver enlargement is there, severe dengue happened there, severe plasma lag, shock, fluid accumulation with respiratory disease distress, severe bleeding, severe organ involvements, liver, ALT and ASTs, impairs consciousness, heart or other organs dysfunctions. Prevention. Anti-mosquito measure has to be done. Avoid open stagnant water in and around home. Bed nets has to be used. Long sleeves clothing has to be heavy wear. In-house spraying has to be done. Repellent has to be done. Pediatric dengue vaccine can be given.